name is Tracy. I'm a physical therapist and partner at the Center for Physical Rehabilitation Plus Performance. We're going to talk about sprains and strains today and how physical therapists can help treat this very common diagnosis. Sprains and strains are created as a result of a loading injury or a loading event to tissues and structures in the body. A sprain involves a strain or injury or a loading event to a joint or a ligament, whereas a sprain involves a loading event or an injury to a muscle or a tendon. Physical therapists are experts in neuromuscular rehabilitation and discovering what causes problems to our neuromusculoskeletal system. Sprains and strains are one of those things that may cause issues with our musculoskeletal system. There are many reasons why we may have a sprain or a strain to our neuromusculoskeletal systems. This might involve an injury or a loading event that might be obvious. For example, a sprained ankle during a basketball game. It might be an individual dealing with low back pain from lifting too much or something that was too heavy. Or it might be a result of a fall from a slip or fall on ice. Other reasons why we may have a sprain or a strain injury are less well defined. These are examples where my patients come to me and tell me that they woke with pain and think that they might have slept wrong, but they cannot identify any particular injury or strain event. Another example may be a patient of mine that comes to me and indicates that they have had pain developing over a period of time, but again cannot identify a particular stress or strain event. Essentially, a sprain or a strain occurs due to tissue loading that exceeds the tolerance of the tissue. So let's think about that for a moment. If we consider suspension bridges, because humans are just simply walking human suspension bridges. If we consider a suspension bridge that's been constructed out of metal and guy wires, if we exceed the load of the ability of that suspension bridge to tolerate the load, it may get deformed in some way, shape, or form. Depending on the load applied to that bridge, it may be a quick or severe deformation that would cause stress or strain to that bridge, or it might be something that was added over time that deformed or stressed that bridge, or twisted or distorted that bridge in some way, shape, or form. This is what happens to our bodies under sprain or strain. The tolerance of our tissues is exceeded by the load applied to our tissues. Sprains and strains could be diagnosed by a physician or a physical therapist. Once an event has occurred, the physician or the physical therapist will do a thorough evaluation to determine the severity of the injury or loading event. And that might include doing a thorough evaluation of medical history. It may involve looking at strength, range of motion, and movement patterns to determine the stress or the strain that has occurred and the severity of that issue. It may also involve, depending on the severity of the injury, diagnostics that would include x-rays, MRIs, or other diagnostic testing to rule out a severe injury. Once a severe injury has been ruled out, physical therapy can proceed safely. Physical therapists, again, will do a thorough evaluation to determine where and why the stresses have occurred and how to offset those stresses in order to get you feeling better and get you back to the things that you love. Depending on what the therapist finds with the evaluation, we may have to provide therapeutic exercises and activities to normalize movement, to stretch things that may be tight, to strengthen things that may be weak, or otherwise normalize movement patterns. We have many ways that we can do this, including the application of therapeutic activities and exercises, education in order to reduce the stresses or the forces that may be occurring to the body, modalities to decrease pain and inflammation to get you moving better sooner, and the application of soft tissue work. There are many applications of soft tissue work that therapists use. We may be treating fascia. We may be performing specialized techniques like functional dry needling, all of which you can learn more about on our website. But one of the things that we use that's very simple and easy to apply and very safe is a soft tissue work technique called trigger point release. I often teach my patients how to do their own self-trigger point release so that they can feel better sooner and feel better in between treatment sessions. A trigger point in the muscle is what people often call a knot. It is a localized area of spasm that is very tender and sore to pressure and may be tender and sore with movement. In order to treat a trigger point, we find the trigger point in the muscle and apply a deep to moderate pressure that is prolonged and held over that trigger point. This creates muscle relaxation and it increases blood flow to the affected tissue. It is and can be quite uncomfortable to perform, so if you're performing this technique, it should always be done in a manner that is tolerated. It will be painful, but it should be well tolerated. One way I teach a lot of my patients to do self-trigger point release for those individuals who have been doing a lot of office work, or for some individuals who do a lot of lifting or repetitive motion for their upper extremity, they may feel trigger points in between their scapular region or their shoulder blade and their spine. These trigger points often radiate pain to the shoulder. It may radiate pain to the upper trap. It may radiate pain to the mid-back, neck, or cause headaches. These can be treated at home safely. Take a simple tennis ball and an empty pillowcase. Drop that tennis ball into the pillowcase. Work your tennis ball into the corner and hold the open end of your pillowcase. Toss the ball to the other side of your shoulder blade, the side that you want to treat, and hold it with the opposite hand. You'll need to move the shoulder blade out of the way and off of the rib cage slightly because most of those trigger points live in that area. Reach that arm that you're treating, or the side that you're treating, reach that arm to your hip, and now you can move this tennis ball up, down, and all around with your pillowcase, and it can't squirrel away from you. Sit against a high back chair or stand against a wall. Put that tennis ball on the sore spot, lean back, and push and hold onto the sore spot. Hold that with prolonged moderate to deep pressure, always tolerable, until the pain dissipates or the muscle relaxes in some way, shape, or form. This might be 10 seconds, or it might be a matter of a few minutes. If you're suffering from a sprain or a strain, come to the Center for Physical Rehabilitation Plus Performance. We'll help you feel better and get back to the things you love to do.